The topic of the tutorial is tongue, and I, Dr. Alpana Kesar, will be covering this topic under the following subheads: surface features of the tongue and papillae, muscles of the tongue, both extrinsic and intrinsic muscles, arterial supply and venous drainage of the tongue, lymphatic drainage of the tongue, and innervation or nerve supply of the tongue. Tongue is a muscular structure present in the floor of the oral cavity. The parts of the tongue are apex and root. Apex is the blunt anterior end, which is present just behind the incisor teeth. This is the root of the tongue. Root of the tongue is that part where the tongue is attached to the mandible and the hyoid bone. The entire tongue is divided into two parts: anterior 2/3 and posterior 1/3. This is anterior 2/3 and this is posterior 1/3. Anterior 2/3 is the horizontal part and posterior 1/3 is the vertical part. The anterior 2/3 is present in the oral cavity and is also known as the oral part of the tongue, and posterior 1/3 forms the anterior wall of oropharynx and thus is also known as the pharyngeal part of the tongue. The upper surface of the tongue, which faces the palate, is known as the dorsum of the tongue. The lower surface of the tongue, which faces the floor of the mouth, is called the ventral surface of the tongue. The features seen in the dorsum of the tongue are presence of sulcus terminalis. Sulcus terminalis, or the terminal sulcus of the tongue, is a V-shaped sulcus that separates the anterior 2/3 of the tongue from the posterior 1/3 of the tongue. Foramen cecum is a small depression present at the apex of the V-shaped sulcus. Foramen cecum marks the site in the embryo where the epithelium invaginated to form the thyroid gland. The surface of the tongue is not smooth. It has numerous small projections present on it that fill the entire anterior 2/3 of the tongue. These projections are called papillae. Papillae increase the surface area of the tongue and they have taste buds present in their wall. There are four types of papillae present on the anterior 2/3 of the tongue. These are filiform papillae, fungiform papillae, valate papillae, and foliate papillae. Filiform papillae are small conical projections that fill up the entire 2/3 of the tongue. They are the most numerous of all the papillae and do not have taste buds present in their wall. Fungiform papillae are present interspersed between filiform papillae. They are usually more concentrated on the margins of the tongue. They are rounder in shape, shaped like mushroom, and hence the name fungiform papillae. They have taste buds present in their walls. Circumvallate papillae are 8 to 12 in number and are the largest of all the 4 papillae. They are arranged in a single V-shaped line just in front of terminal sulcus. They are blunt-ended cylindrical papillae present in invaginations or depressions on the surface of the tongue. They are surrounded by a depressed area, space or trough all around it, and hence the name circumvallate papillae. They have taste buds present in their wall. Foliate papillae are linear folds of papillae, or rather linear folds of mucosa present on the sides of the tongue close to sulcus terminalis. They have taste buds present in their wall. Muscles of the tongue. Median sagittal septum, made up of connective tissue, divides the tongue into equal right and left halves. Tongue is primarily a muscular structure which is composed of 8 muscles present on the left side and the same 8 muscles present on the right side. Hence, all the muscles are present in pairs. There are two groups of muscles present in the tongue: intrinsic muscles and extrinsic muscles. Intrinsic muscles take origin from structures within the tongue and get inserted in the tongue. They help in changing the shape of the tongue. Extrinsic muscles take origin from structures outside the tongue and get inserted in the tongue. They help in bringing about movement of the tongue. All the muscles of the tongue are innervated by hypoglossal nerve, except for palatoglossus, which is innervated by vagus or the 10th cranial nerve. Extrinsic muscles of the tongue. Extrinsic muscles of the tongue take origin from structures outside the tongue and get inserted in the tongue. The movements brought about by extrinsic muscles are protrusion, that is, forward movement of the tongue; retrusion, or backward movement of the tongue; depression, or downward movement; and elevation, or upward movement of the tongue. The 4 extrinsic muscles of the tongue present on each side are genioglossus, hyoglossus, styloglossus, and palatoglossus. Genioglossus muscle. The origin of genioglossus muscle is from the superior genial tubercles. Superior genial tubercles are present on the posterior surface of the anterior part of the mandible. There are two pairs of genial tubercles, superior genial tubercles and inferior genial tubercles. Genioglossus takes origin from the superior genial tubercles. Insertion of genioglossus is to the entire length of the tongue. This muscle is genioglossus. Action of genioglossus is to protrude the tongue, that is, take it forwards and depress the center of the tongue. Genioglossus muscle is also known as the safety muscle of the tongue. This is so because it is the only muscle of the tongue that has an anterior attachment, that is, to the genial tubercles. This anterior attachment of the tongue holds the tongue in place in the oral cavity and prevents it from falling back into the pharynx during sleep and unconscious states. However, if bilateral fractures of mandible take place, then the anterior segment of the mandible may dislocate backwards. If the anterior segment of the mandible dislocate backwards, it will carry the attachment of genioglossus along with it, and the tongue will fall back into the pharynx, blocking the air passage. So, whenever there are bilateral fractures of mandible, care must be taken to keep the tongue in place and maintain patent respiratory passage. Hyoglossus muscle. Hyoglossus muscle takes origin from the hyoid bone. It takes origin from the greater horn and the adjoining parts of the body of hyoid bone. Insertion of hyoglossus muscle is on the lateral surface of the tongue. This muscle is hyoglossus. In this visual, this muscle is hyoglossus. The action of hyoglossus is to depress the tongue. Hyoglossus muscle has some important, clinically relevant relations on its superficial and deep surface. Its superficial relations are lingual nerve, submandibular ganglion, hypoglossal nerve, and deep lingual vein. Its deep relations or structures present deep to it are lingual artery and the accompanying dorsal lingual vein. Styloglossus. Styloglossus muscle takes origin from the styloid process, more precisely from the anterolateral surface of the styloid process. It gets inserted on the lateral surface of the tongue. This muscle is styloglossus. Its function is to elevate the tongue and retract it backwards. Palatoglossus takes origin from the inferior surface of the palatine aponeurosis and gets inserted on the lateral surface of the tongue. It helps to elevate the back of the tongue upwards which will help to close the oral cavity from the oropharynx. Intrinsic muscles of the tongue. Intrinsic muscles are those muscles which take origin from structures within the tongue and get inserted in the tongue. The extrinsic muscles helps to move the tongue, but intrinsic muscles only help to alter the shape of the tongue. They help in lengthening and shortening the tongue, curling and uncurling its apex and edges, and flattening and rounding the surface of the tongue. These movements of the intrinsic muscle contribute to the precise movement of the tongue that is required for speech, eating, and swallowing. The intrinsic muscles of the tongue are superior longitudinal, inferior longitudinal, transverse, and vertical muscles. Superior longitudinal muscle. Superior longitudinal muscle is this. It is present just deep to the dorsum of the tongue. Its origin is from the submucosal connective tissue at the back of the tongue and also from the median septum. Insertion is into the submucosal connective tissue anteriorly. The fibers run from the submucosal connective tissue posteriorly to the submucosal connective tissue anteriorly, and these are the fibers of superior longitudinal muscle. Action of superior longitudinal muscle is to shorten the length of the tongue. It also helps to curl the apex and the sides of the tongue upwards. Inferior longitudinal muscle. This muscle is superior longitudinal and this muscle is inferior longitudinal. Both superior and inferior longitudinal muscles run parallel to each other. Superior longitudinal muscle runs beneath the dorsum of the tongue, while the inferior longitudinal runs beneath the ventral surface of the tongue. The origin of inferior longitudinal is from the root of the tongue, including the hyoid bone. The fibers run forward and get inserted into the apex of the tongue. Action of inferior longitudinal muscle is to shorten the length of the tongue and also uncurls the tongue and turns the apex of the tongue downwards. Transverse muscle. These are the fibers of transverse muscle. The fibers run from the median septum of the tongue to the submucosal connective tissue on the lateral margin of the tongue. The fibers run horizontally. When the muscle contracts, it will narrow the tongue and thus helps to elongate as well. Vertical muscle of the tongue. The origin of the vertical muscle of the tongue is from the submucosal connective tissue on the dorsum of the tongue to the submucosal connective tissue on the ventral surface of the tongue. The fibers run vertically downwards. These are the fibers of the vertical muscles running vertically downwards. The action of the muscle is to flatten the tongue. And as it flattens the tongue, it also helps to widen it. Students, don't forget to like this video and subscribe to the channel to stay updated with the latest exam questions. Arterial blood supply of tongue. The artery of the tongue is lingual artery. Lingual artery is a branch of external carotid artery. It arises from the external carotid artery opposite the tip of the greater horn of hyoid bone. After originating from external carotid artery, the lingual artery forms an upward loop. Then it passes deep to hyoglossus muscle. This muscle is hyoglossus. Lingual artery runs in the floor of the oral cavity. It then passes between hyoglossus and genioglossus muscle. The lingual artery reaches the apex of the tongue and supplies the tongue and the floor of the oral cavity. Veins of the tongue. There are two veins that drain blood from the tongue. They are dorsal lingual vein and deep lingual vein. Dorsal lingual vein accompanies the lingual artery. It runs between the hyoglossus and the genioglossus muscles. After draining blood from the tongue, it will drain into internal jugular vein. Deep lingual vein. Deep lingual vein is visible through the mucosa on the undersurface of the tongue. It drains blood from the tongue and the floor of the mouth and finally drain into the internal jugular vein. Lymphatics of the tongue. The lymphatics of the tongue is divided into four areas: the tip of the tongue, the lateral part of the anterior two-thirds of the tongue, the middle part of the anterior two-thirds of the tongue, and the posterior one-third of the tongue. The lymphatic drainage from the tip of the tongue, the middle part of the anterior two-thirds, and posterior one-third of the tongue is bilateral, and the lymphatic drainage from the lateral part of the anterior two-thirds is ipsilateral. Bilateral drainage means that from the left part of the posterior one-third of the tongue, the lymphatic drainage will be into both right and left-sided lymph nodes. Likewise, from the tip of the tongue and the middle part of the anterior two-third, from any part of these areas, the lymphatic drainage will go into both sides of lymph nodes. Ipsilateral drainage, which occurs from the lateral part of the anterior two-thirds of the tongue, means that the lymphatic drainage from left part or left side of the tongue will go into left group of lymph nodes. Next, we will try to understand the various lymph nodes in the head and neck region. In the head region, there are 5 group of lymph nodes. They are submental, submandibular, parotid, mastoid, and suboccipital. The lymphatic drainage from the tongue will be into submental and submandibular group of lymph nodes. Submental is present just below and behind the anterior part of the mandible, while the submandibular group of lymph nodes is present in the submandibular triangle. Apart from that, lymphatic drainage will also take place in cervical group of lymph nodes. There are two groups of cervical lymph nodes, superficial and deep. The deep group of lymph nodes are those which are present along the internal jugular vein. They are further divided into two: upper deep cervical group of lymph nodes and lower deep cervical group of lymph nodes. In upper deep cervical group of lymph nodes, the most prominent lymph node is jugular digastric. And in the lower deep cervical group of lymph nodes, the most prominent lymph node is jugulo-omohyoid. Now that we have understood the different groups of lymph nodes, we will try to understand the lymphatic drainage from different areas of the tongue. From the tip of the tongue, the lymphatic drainage occurs bilaterally into submental group of lymph nodes. From the lateral part of the anterior two-thirds of the tongue, the lymphatic drainage is ipsilaterally in the submandibular group of lymph nodes. From the middle part of the anterior two-thirds of the tongue, the lymphatic drainage is into deep cervical group of lymph nodes. Lymphatics may either pass directly into the deep cervical group of lymph nodes, or it may first pass to the submandibular group of lymph nodes and then to the deep cervical group of lymph nodes. Here, the lymphatic drainage occurs bilaterally. Lymphatic drainage from the posterior one-third of the tongue occurs bilaterally into deep cervical group of lymph nodes. It specifically goes to the jugulo-omohyoid or upper deep cervical group of lymph nodes. Finally, all the lymph, whether it is from submental, submandibular, or upper deep cervical group of lymph nodes, will flow through the lower deep cervical group of lymph nodes. Innervation of the tongue. First, sensory nerve supply of the tongue. In the anterior two-thirds of the tongue, the general sensations, that is sensation of touch, temperature and pain, is carried by lingual nerve, which is a branch of mandibular division of trigeminal nerve. Taste sensations or gustatory sensations are carried by cauda tympani branch of facial nerve. The gustatory or taste sensations from the circumvallate papillae, which is present in front of sulcus terminalis, is carried by glossopharyngeal nerve. From the posterior one-thirds of the tongue, both general and taste sensations are carried by glossopharyngeal nerve or the ninth cranial nerve. From the posterior most part of the tongue, both general and taste sensations are carried by vagus nerve, which is the 10th cranial nerve. Motor innervation of the tongue. All the muscles of the tongue are innervated by hypoglossal nerve, which is the 12th cranial nerve, except for palatoglossus muscle, which is innervated by vagus nerve, which is the 10th cranial nerve. Clinical anatomy of tongue. Smooth tongue is when the filiform papillae are lost, which may occur in some anemia. Inflammation of the tongue is called glossitis. Lingual tonsils form a part of Walder's lymphatic ring. Genioglossus is the safety muscle of the tongue. It is the only muscle which attaches the tongue anteriorly to the mandible. This holds the tongue in place in the oral cavity and prevents it from falling back into the pharynx, thus blocking the air passage. Any damage to the 12th cranial nerve will result in paralysis of the muscles of the tongue on the same side. When the patient is asked to protrude the tongue, the tip of the tongue gets deviated to the affected side. Carcinoma of the tongue is common. In this, the affected side of the tongue is removed along with the deep cervical lymph nodes of the affected side. In carcinoma of posterior one-third of the tongue, the deep cervical lymph nodes on both sides may have to be removed due to bilateral lymphatic drainage of posterior one-thirds of the tongue. Important exam questions from the topic tongue include: enumerate all the muscles of the tongue with their nerve supply, describe all the intrinsic and the extrinsic muscles of the tongue under the following subheads: origin, insertion, nerve supply, and action. A short note on genioglossus may be asked. It may also be asked as the safety muscle of the tongue, or a question as which is the safety muscle of the tongue and why. Relations of hyoglossus, nerve supply of tongue, lymphatic drainage of tongue are both important questions. Other than that, arterial supply and venous drainage of tongue may be asked. Papillae of the tongue and taste buds is yet another question that may be asked from the topic tongue.